Hello, everyone. Today I'm honored to have Dr. Erin Bellamy in this show. Dr. Erin Bellamy is a chartered psychologist, metabolic psychiatry practitioner, and the CEO of IKRT, Integrative Ketogenic Research Therapies. She holds a PhD in psychology and a Master of Science in Psychiatric Research and is a research fellow at the University of East London with over a decade of experience in ketogenic therapy. Dr. Erin combines clinical work, research, and training to advance the field of metabolic psychiatry. She is an associate fellow of the British Psychological Society and a member of the Society of Metabolic Health Practitioners. Welcome, Dr. Erin. I'm really honored to have you with us today.
Thank you so much for having me on. I'm very excited to join you and to join all of your Arabic speakers who are listening in.
Thanks. Many in our Arabic speaking audience may be hearing about ketogenic therapies for the first time. So could you briefly introduce yourself and introduce your work in that area?
Yeah, absolutely. So, um, I've been doing this for a while. I've been doing this for just over 10 years now. And so my background is psychology, like you mentioned. I'm a chartered psychologist. So this is a little different to clinical psychology, whereby people would be working with individuals and carrying out, different therapies. Instead, I have my chartered psychology degree more so down the research route. So, research psychology, the science side of it, that's always been my focus. And the reason why, I kind of fell into the research side is because back then metabolic psychiatry wasn't a thing, it wasn't a field. It's a relatively new term for the field that we have now. But I was very, very curious as to how nutrition could impact psychiatric conditions and mental health disorders, not just simply mood, improving mood, but how could certain ways of eating influence the underlying mechanisms of mental health conditions. And so that journey started for me back in 2014, 2015. And I went on a long road of research and my PhD included, which I'm sure we will get into today. And then that led me on to opening up private practice and working as a practitioner with people to implement ketogenic therapy to improve their mental health. So yeah, so that's kind of where I'm focused and where I'm based. And I'm sure we're going to get into now, exactly what I'm doing day to day and what the research says.
Yeah, so what brought you into doing what you are doing? Why did you choose that career?
Mhm. I think if you ask anybody in this area, and you may, the people that you've come across in this area, you may already have had this discussion with them, face to face. I think we all fell into it by accident. Because it didn't exist, and when I was working in the mental health field in the UK in the National Health Service, I was just interested in what people were eating and how the food was impacting them. And, I knew about low carbohydrate diets, and I knew that a low carbohydrate diet could improve symptoms of type 2 diabetes. I knew it could improve glucose control. I knew that there were even some secondary outcomes whereby mood was improved with a low carbohydrate diet. And it just got me thinking, well, the people that I'm working with who are really suffering from mental health conditions, severe mental health conditions, perhaps they would benefit from a low carbohydrate diet or even a ketogenic diet, which is much lower in carbohydrates. And, there's some other mechanisms at play there. And so back then in 2015 or so, I thought it would be interesting if, we were to implement this with these individuals and see how does it affect them? Do their symptoms improve? Does anxiety improve? Do their hallucinations dissipate? But back then, when I went looking in the research to see had this research been done, there was only a couple of research studies from the 60s and 70s even suggesting that it could be possible. So that's how I then fell into the research side, because I wanted to practice clinically. I really wanted to work face to face with people as a clinical psychologist, but the research base, the evidence base hadn't been fully hashed out. There were just a couple of studies, but the rest of the research hadn't been done. And as you know, you can't really do much if the research isn't there, or you don't really have a leg to stand on when it comes to implementing it with people. So I then said, okay, the research has to be done. I will go and I will do my PhD. I will, run a trial looking at depression and using a ketogenic diet with people who have depression to see, does it improve their symptoms? And then if it does, well, then I have a leg to stand on, and I can then, hopefully go and do this with people to see if it helps them feel better. In the meantime, while I was doing my PhD and carrying out that research, there were lots of other people around the world doing the same. So Dr. Ian Campbell in Edinburgh, he was doing something similar. Dr. Shabani Sethi in the US, she was doing something similar. And we didn't know each other because this was before Zoom, this was before COVID. This was back when we sent messages by pigeon, so we didn't know about one another. And it was only, after, in and around the time of COVID where we came together and we were able to say, wow, everybody's kind of trying to push the needle at the same time. And then as a result, metabolic psychiatry in the field was born. And now, research is flying. We're doing really well with getting the research out and so on. So that's how I fell into it. It was almost by accident because the research hadn't been done. And I thought, well, somebody has to do the research, so let's go. And yeah, here I am, 10 years later.
Yeah, it's a really nice story. You've worked so many years in the mental health field. So to dive into our today's conversation, let us start with this first question. What do you think is currently wrong in the mental health field from your own perspective?
It's a tricky one. I think we're doing a lot of things right and we mean well, okay? But I think the biggest issue stems from the fact that 50 or so years ago, we moved away from nutritional interventions and other interventions, and we moved towards using antidepressants and antipsychotic medication in order to treat symptoms. So we have this model whereby we are using medications to treat people. Individuals need to hit a couple of different criteria to be given a diagnosis, and once they have a diagnosis, then they get a certain medication for that diagnosis, right? But I have never met two people with the same diagnosis who have the same symptoms, okay, ever. There may be similarities, but they're never the same. So I think what we're missing is the bigger picture. You can't just give medication to people just because they have some similarities in their presentation. And we also can't just look at mental health diagnosis and psychiatric illness as something that happens to the brain and not the rest of the body. So there are kind of two things there. We have to remember that the brain is attached to the body. What you do to the body affects the brain. What you do to the brain affects the body. So looking at the whole individual. And then at the same time, we have to remember that you can't just give a medication just to cover up the symptoms, because you're not addressing the root cause. And if you end up giving a medication for something, that medication has side effects, and then you end up giving another medication for the side effects, and you end up with somebody who's on a lot of medication for different things, with still the underlying mental illness. because it has not been addressed at the root cause. So that's where I think we went wrong. We're not addressing the whole person, and we're just trying to give medications for the symptoms to cover them up, rather than addressing the root cause.
Great answer.
Thank you.
So since our main topic is ketogenic therapies, what are the shared pathological mechanisms of mental illnesses, and how does ketogenic therapies treat that root cause transdiagnostically?
Yeah, this is a very good question, and it's something we could talk about for hours, I think. I would point your listeners toward, especially if they're, if they've got translation services or can read English, I would definitely point them towards, there was a paper written by Dr. Christopher Palmer. It has the word transdiagnostic in the title. So if you just put that into Google, it'll come up. But it really covers all of the different avenues and mechanisms by which we believe ketogenic therapy is improving mental health. And so there are about 6 or 7 kind of root causes or shared pathways that we are pretty certain are at play right now. I am sure that there are more, okay, because we are really just scratching the surface when it comes to understanding all of the mechanisms that are at play. But I'll kind of go through them. The first one we have is brain glucohypometabolism. Bit of a tongue twister, but essentially what this means is that the brain has access to glucose. So glucose in the body goes up to the brain, fuels the brain. But what happens when mental health symptoms worsen is the glucose that's up in the brain doesn't, it sees it, but it doesn't know how to use it. It's like it's forgotten how to use the glucose. And so it says, okay, we need to shut everything down. We don't have any energy. We can see the glucose, but we can't use it. We don't have any energy. Let's shut things down. So people become sluggish, fatigued, there's lethargy, brain fog, struggling to recall words, and so on. So that's one of the first mechanisms that's at play. Another is neurotransmitter imbalance, which some of your listeners are probably familiar with. Okay, so things like glutamate being way too high. When we introduce the ketogenic diet, we actually see glutamate come down and regulate, and GABA goes up. So we have kind of regulation of the neurotransmitters. Then we have oxidative stress, again, something that your listeners may be familiar with. With oxidative stress, what we have is a fuel system which does not burn as cleanly as we would like. In other words, when we feed the body with glucose, we need to create energy, create ATP. And by doing that, what we have or what we get is kind of debris or extra kind of bits and pieces that come off when we create this energy, and this is called oxidative stress. And so these little molecules, they build up, they put a lot of pressure on the body, and we have a couple of detox pathways as humans that work very well, but in the current environment we don't always have a way to detox as quickly as we would like. Environmental factors get in the way. And so with the oxidative stress, it builds up. Okay. And when it builds up, it causes mental health symptoms or contributes to the worsening of mental health symptoms. If you move over into a ketogenic diet, right, and you use ketones as energy, they burn much cleaner. It's a cleaner fuel. It doesn't have the buildup of debris like when you are using glucose as energy. And so your detox pathways, you're able to detox more readily and easily, and you don't have as many symptoms. So that's kind of the third way. The third mechanism at play there is oxidative stress. The other ones we have are neuroinflammation. Again, I think you and I had been going back and forth with email, and you'd mentioned, Dr. Martin Picard's neuroinflammation theory. So neuroinflammation, inflammation in the brain. We don't need to go into all the ins and outs of that, but inflammation in the brain contributes again to mental health, worsening of mental health symptoms. And a ketogenic diet is anti-inflammatory. You know, we see an LRP3 and all the ILs come down and regulate. So we've got the counter effects of the ketogenic diet there. And then the last two are insulin resistance and mitochondrial dysfunction. So insulin resistance is probably one that your listeners are quite familiar with, right? Because insulin resistance affects many people, you know, these days. Most people these days are kind of metabolically unhealthy and have high levels of insulin resistance. What we see when you introduce a ketogenic diet is you become more insulin sensitive. So insulin resistance from the standard diet, from the standard ways that we live, and the ketogenic diet helps to reverse that and to improve your insulin sensitivity. And then finally, I'm going on a bit of a tangent here, but finally, then we have mitochondrial dysfunction. And so I believe that mitochondrial dysfunction is really at the core, because you have all of the other ones that I've mentioned, but the mitochondria and the health of the mitochondria influence all of those that I've mentioned so far too. So really, you could look at mitochondrial dysfunction as being the root cause. You know, if you go all the way back to the health of the cell and you look at the individual mitochondria, our environment, the way we live, the food we eat, the people we surround ourselves with, the chemicals, you know, all of these things, they influence the health of our mitochondria. And if our mitochondria break or become damaged, they become faulty, the cell cannot act in the way that it needs to. And if you've got lots of mitochondria in these cells not behaving the way they should, that then contributes to the worsening of mental health symptoms. But the fascinating thing is that the ketogenic diet, a therapeutic ketogenic diet, improves the health of the mitochondria. So if you have broken or damaged mitochondria, it will help to fix that mitochondria. If the mitochondria is damaged beyond repair, it will clean it out. It will get rid of it. It will also encourage mitophagy. So the development or the creation of brand new mitochondria in the cell. So we can look at it as kind of like a cleaning up process, and a process by which we can improve the health of the cells and improve the health of the mitochondria, which further down the line improves the health overall of the individual and reduces the mental health symptoms that that person might be dealing with. So that's it, not very much in a nutshell, but they are kind of all the different shared pathways that we know of at this time, and how ketogenic therapies can influence the mental health of the individual. Does that help? Is that clear? It was quite a
it looks like it's doing much more than just a diet. So yeah. Okay, so let's move to our next question here. One of the biggest challenges when we talk about this new kind of therapies is that the criticisms that we get, because people simply say that, oh, there's no much clinical evidence, or there's no much research for for this topic. So since you are a researcher, so could you walk us through the current evidence we have for ketogenic therapies, and what are some of the most powerful researches that have been published since now?
Yeah. I get this all the time. So just like you know, I hear from people, oh, there's no research, oh, there's no evidence, you know, and or the research isn't, or there's not enough, you know, there's not enough randomized control trials, or there's not enough, you know, research to do this. And before I go over the evidence, I want to remind people that we don't have a randomized control trial that shows that smoking causes lung cancer. Okay, we don't have that, and yet we know it's a strong contributor, right? If you smoke, it's likely to contribute to the onset of lung cancer. Not in everyone, but most people would say, you know, we're not smoking because we don't want that. it would not be ethical to run that randomized control trial. We can't do that, right? We can't get people to smoke, some not to smoke, and see what happens. So we don't always need to wait for randomized control trials to come out to change the way that we behave or to change the way that we eat. Having said that, with the ketogenic diet and ketogenic therapies, we have safety data as far back as 1920s, right? So in the 1920s, the ketogenic diet was used, a very restrictive ketogenic diet was used to treat children with treatment-resistant epilepsy. So the ketogenic diet, very restricted ketogenic diet, was used to stop children from having their seizures when medications were not working. Okay. And so since then, we have decades of research on how to implement it in children with epilepsy, how to look out for nutritional deficiencies, how to do it safely, what are the contraindications. We have so much research on how to do that. It's not specifically for mental health, right? But it is for epilepsy. And the diet that we are using is a therapeutic ketogenic diet that is not as strict as the one used in epilepsy. So we got a little bit more wiggle room, okay? And so it doesn't even need to be at that level. So we've got a lot of data that we can rely on. You know, it's a diet that, out of all the diets, it's the diet with the most research on it, more research than a vegan diet, a vegetarian diet, or a Mediterranean diet. And yet still we have people saying, oh, there's not enough research. But if we come forward now to maybe the 1960s, that's where we had the first pilot study looking at the ketogenic diet in schizophrenia, and the outcomes were positive. You know, some people, some women in an inpatient unit were put on a ketogenic diet. Their symptoms improved, and then when the standard diet was reintroduced, their symptoms worsened again. Then in the 1970s, there was some research that looked at whether schizophrenia was rare in the population if grains, whole grains, were rare. And it seemed to be so. So already we were seeing the connection between carbohydrates and mental health diagnoses. The research back then also was showing, actually, I think as far back as 1938, was showing that individuals with schizophrenia had abnormal reactions to the metabolism of carbohydrates. So we already knew there was something at play there, but we hadn't really pulled all the dots together. Then more recently, if we look at the past kind of 5 or so years, now that the field of metabolic psychiatry is really, you know, forging its way forward, we have plenty of case studies and case series detailing exactly how individuals used ketogenic therapy to improve schizophrenia, depression, schizoaffective disorder, OCD, PTSD, bipolar disorder 1 and 2, and binge eating disorder and weight-stable anorexia nervosa. So lots of case studies and case series which are filling up or have filled up the base of our research pyramid, right? We have some, what's the next on our list? We've got some retrospective and some prospective studies that have been carried out. We have had the first randomized control trial, or the first pilot trial, excuse me, looking at schizophrenia and bipolar disorder and the ketogenic diet with very positive results. I know there are 2 randomized control trials that have been completed, and they are in production for publication. So they'll be coming out shortly. And I think we have about 11 to 13 other randomized control trials that are currently underway. So the research is being done, and it's coming out at a rate that I think you and I struggle to keep up with. We even, as recent as yesterday, I believe, we have a brand new consensus study where a lot of the researchers kind of came together and they created something called a Delphi consensus. They reached out to many clinicians, including myself, and asked us, how are you implementing this with individuals? What are you finding? What are the biggest struggles? And they were able to come together and they were able to come up with some statements that they could all agree on that is true for how we should implement ketogenic therapies in mental health. And that is now open access and you can find it online. And it's really showing us just how, one, this is real. People are seeing incredible improvements in their mental health. There's nuance, of course, but for the most part, it's extremely powerful for individuals. But two, that there are now kind of clinical guidelines and things that we can follow in order to support individuals with this implementation. So we're pretty much kind of filling up all the different levels of the research pyramid, everything from case studies and case series up to randomized control trials. And then also we are looking at how do we reach different populations. So, for example, there was a study carried out in at Ohio State University. They did the ketogenic diet in depression with students in university. You would think that they would just want to be out partying and drinking, but they were able to implement the diet. We have another study underway. It's looking at ketogenic diets in children and young adults for their mental health. My most recent research project is focused on using an online remote program. So combining education and the implementation of the diet remotely. So you don't have to go and see someone face to face, or if you live in Alaska or you live in Papua New Guinea, as long as you've got an internet connection, you can still access services. And seeing, are those services and does that program work as well as if you and I were face to face? And that way we can reach people who are geographically stuck or, in difficult parts of the country to reach. Or if they're struggling, with their mental health so much that they can't leave the house or they can't get up, as long as they can join by the internet, well, we can reach them. So there's a lot. There's a lot of research and plenty more coming through over the next couple of years, which is really, really exciting.
Mm-hmm. So I will do a follow-up question here. So since we are talking about research, there was a recent debate about what Robert F. Kennedy said. The statement, he said that ketogenic diets can treat and can cure schizophrenia. What do you think about that recent debate?
Yeah, so I think the whole world probably saw that. And if not, put it into Google and you'll see it. I am very pleased to hear that that he is aware that this research is being done and that people are using ketogenic therapy to improve their mental health. It's great that he even said the words schizophrenia and ketogenic diet, right? That's great because it means people are curious and they'll go and they'll try and learn. I don't agree with the term cure. I think it's a long stretch, and I don't think it was maybe the best word to use. I don't believe there's anybody in the research or clinician or practitioner community that would say that what we are doing is curing people. That is not the case, right? There are plenty of people who have improved their mental health so considerably that they no longer reach the criteria for those diagnoses that they have had. They may have had diagnosis for decades and they are no longer classified as having those diagnoses. They would therefore reach, or they would therefore match with the term remission, possibly, right? They may say I'm in remission from this this diagnosis, a little bit like with type 2 diabetes. People will say, you know, I follow a ketogenic diet or a low carb diet. My type 2 diabetes is in remission. If they then go and eat a lot of carbohydrates again and they come out of ketosis, right, it's likely that their blood sugar levels become unstable and they return to their previous state. So remission is likely a better term. So I believe, you know, for a lot of the people that I work with, that remission is possible. You know, I have many people who no longer match the criteria for their diagnosis, and therefore they would say, I'm in remission. However, there is a difference between the type 2 diabetes group that I just referenced, where if they then go back to their old ways of eating a standard diet, they may redevelop type 2 diabetes. Okay. There's a difference between that and what I see in the people I work with, because some people, they improve, they no longer reach the criteria for the diagnosis, and they would say, I'm in remission. Okay. But then if they come out of ketosis and they go back to eating the way they did before, their symptoms return. Okay, their hallucinations might come back, or their anxiety might worsen. And so they could say, I'm in remission when I'm in ketosis. Like, I don't have symptoms, my symptoms are managed very well, and therefore, you know, I need to stay here in order to get the benefits. But then I have some other people that I've worked with who no longer match the criteria for diagnosis. They might say they're in remission, but after a period of time, even if they come out of ketosis and they eat a lot of processed foods and carbohydrates, their symptoms don't always come back. And in one or two cases, I've had people who have come after about a year or so in ketosis, have come out of ketosis and eaten a whole bunch of ultra processed foods. I didn't tell them to do that. They just went and did that. Okay. And they remain symptom free. So I don't know what that is. I'm not going to use that C word. Okay. But that's not remission, that's something else. There's a level of healing there that's gone on in the brain whereby they don't need to follow the diet as strictly, and they don't seem to get the returning of those negative symptoms. So that's something we still need to explore. These two different groups. Some people, the symptoms come back when they come off the diet, and other people, the symptoms don't come back when they come off the diet. And what do you call that? I don't know.
Remission.
Yeah. Yeah.
So to follow up with a question here, because this is a very very famous question that we get asked too many times. The question about is this a lifelong intervention? Do I have to stay on keto for lifetime? Is there any criteria or different things that differentiate between the people who are able to stop the diet and the people who have to stay on the diet for the rest of their life? For example, does the people with schizophrenia must stay on the diet, and the people with something milder like bipolar type 2 can exit the diet? And what about something like cycling? Cycling is a diet, because many people ask me this question: can I, for 1 week, can I get off the diet and nothing will happen? So I know this is very hard area to talk about, and we don't have much data yet, but I would love to hear your own opinion.
Yeah. And so I'll, you know, all of my answers are either going to come from the research or from what I see in practice. And you're right, we don't have research on this yet. So my answers come from what I see in practice. Going back to what I said earlier about not having met two people with the same diagnosis who have the same symptoms, I don't believe we can say, or I haven't seen it be that, you know, if you have schizophrenia, you must stay on, and if you have depression, you don't have to be on as long. I think it comes back to the individual. What I seem to be observing is younger people with maybe less diagnoses, right? So not multiple diagnoses, with less diagnoses, with less comorbidities, with less time on medications. Perhaps they're medication free, or they're only on maybe 1 or 2 medications. They appear to need less time in total on the diet compared to somebody who is older, multiple comorbidities, maybe also some type 2 diabetes, lots of medications, perhaps postmenopausal, or perhaps has some other physical health concerns, and multiple diagnoses. And that's not difficult to understand why, because in the younger person, there's less overall damage, perhaps. If there's a 20-year-old and a 65-year-old, you've also got 45 years worth of life, So it would make sense that if we're trying to heal the brain and trying to fix certain aspects and mechanisms in the brain, that the person that's more complex may take longer. And so I appear to be seeing that, but I can't say that for certain, right? Because we don't have the research to back it up. Also, you have to look at the individual's commitment to the process, because you might have somebody who hums and haws and takes 3 or 4 months to get into ketosis, and then's like in and out, and then kind of gets good levels, feels a bit better, but then goes off on holiday, or and so they don't have that deep time in ketosis for things to improve. And then you might have somebody else who gets into ketosis and stays there and is very committed and doesn't stray. And when you compare the two, the first person's been on keto for 2 years, but kind of haphazardly, and then you've got somebody who's been on it for 6 months fully in it, and they are seeing more improvements than this person because of the way they've approached it. So there's lots of kind of confounding variables. I get asked this all the time, just like you. Can I come off? How long do I have to do it? Do I have to do it forever? Nobody likes the idea of forever. So I just say, listen, we're going to take it one day at a time. You definitely need at least 3 to 6 months. If you can commit to a year, that's great, because you're really going to be in your groove. You're going to have given yourself enough time to get in, see if it works, see how you feel, make it a lifestyle. And then at the end, you can say, okay, like I did it. Did it work? Did it improve? Do I want to stay on it or not? Usually, if we look at the epilepsy research, again, this is from children, so young people with brains that are still growing. After about 2 to 3 years, some of those individuals were able to come out of ketosis, and they remained seizure free. And other individuals they came out of ketosis and their symptoms came back and they had to go back in. And I seem to be seeing the same myself. Throughout the journey, when I work with people, I might say, okay, let's take a little bit of time with higher carb and see how you feel. Also, they might want a little bit of a break, or they might want to kind of loosen up a little. And instead of going for the cookies and the biscuits, I say, okay, let's add another 10, 15 grams of carbs this week and see how you do, right? And they might do that and feel fine, in which case I'll say, okay, well, you can stay here or go back in. It's up to you. Or they might do that and their symptoms get worse. So their symptoms come back. The intrusive thoughts come, the suicidal ideation, the like irritability, the disrupted sleep. And then they usually say to me, I'm going back in. Okay. And so it's very personalized with how people kind of come in and out. In terms of cycling, with the cycling aspect, I don't think it's a good idea. Okay, I know people do it, and usually the reason why people ask if they can cycle, they ask it ahead of time, first of all. They're like, oh, can I cycle at some point? And that's just because they're scared of doing it long term. They're scared of never being able to have a cake again or something like this, right? When you actually get into it, it's not about cycling. They just want to know if they could maybe have some carbs from time to time and get away with it. And then I say to them, it's something that you have to test. And when they test it, they learn. I have done this in the past and I know it doesn't work, but I'm not going to tell them that because they need to find out. Well, I'll tell them, but then I also say you need to experiment with this yourself. Okay. So they might come out of ketosis, and more than likely, if anybody's, if you think about being in ketosis and how it makes you feel good. And when you come out of ketosis, you get irritable, you get angry, you get very hungry because you have no appetite suppression from ketones. You get very tired. Your energy is not as good. You're on a blood sugar roller coaster. And then on top of that, you may have, your mental health symptoms come back and worsen. So that's usually when people come back and say to me, it wasn't worth it. They went to a birthday party, or they celebrated Eid, or they, celebrated Christmas and they came out of ketosis, or they cycled for that week, and they'll come back and say it wasn't worth it, because then it takes 3 to 5 days to get back into ketosis. So that's like a whole nother week of getting back into ketosis and feeling fluey and having to have dysregulated electrolytes and disrupted sleep. And people just say it's not worth it, right? And you really want the benefits of being in ketosis with ketones most of the time. So I would say to people, don't cycle. But don't freak out thinking, oh, I can't do this forever, right? There's always a little bit of gray area where sometimes you can have maybe a few more carbs if needed, but it's not out of ketosis, in ketosis. It's very disruptive to the body to kind of go between the two when your goal is to look after your mental health. Different goals, yes, maybe cycling works, but not for the purpose of improving mental health, at least at this point.
Yeah, I love that answer. Okay. Um, I want to jump into a specific topic here. I want to talk a little bit about the work of Dr. Martin Picard. I really love his work on neuroinflammation and mitochondria and all of that. So, could you please help our audience better understand what is neuroinflammation, and how does chronic stress, according to Dr. Martin Picard, and what he says, that chronic stress plays a role on increasing neuroinflammation, and why we see so many times that many people get into psychosis after a prolonged period of life stressors or traumatic events. Could you please help our audience understand this part better?
Yeah. I think if I'm being completely honest, you probably want to try and get him to come along and join your podcast, because he is an absolutely phenomenal individual, the work that he has done and the way that he explains everything. If you go on YouTube and you can watch some of his podcasts and some of his videos, he has a great way of explaining neuroinflammation and the mitochondrial theory that he has in a way that's easy to understand, right? And also he's so passionate about it, which just adds to it, right? But So I point your listeners definitely to him on YouTube, because I can't do a job like he does. Okay, I'm telling you, I know my limits, and I can't do it like he does. But I do encourage people to go and listen to him. But what I can speak about is, kind of the second aspect, which is, when people have prolonged periods of stress and life events, like how does this then contribute to psychosis or the worsening of symptoms or first episode psychosis and so on. And really it comes back to, when I was talking to you earlier about oxidative stress and neuroinflammation and so on, it comes back to some of those shared pathways. Because stress is something that, as humans, we deal with on a daily basis, and oftentimes like acute stress, so short-term stress, is beneficial for the body because it helps us to adapt, right? We have a stressor comes along, we adapt, we know how to overcome it. Our body becomes stronger as a result. We even have things like hormetic stressors, like fasting, for example, and exercise, where there's stress on the body initially, but then afterwards, we are more resilient and we are stronger human beings. So stress is not always a bad thing. But when you have something like chronic stress, where your stress level, it starts off as acute, okay, but then every day it is the same, day in and day out, and you have stress upon stress upon stress, all compounding for that individual, be it from, the environment that we live in, from relationships with people that are not positive, maybe stress on, stress from our family members, or stress from ourselves on, trying to be the best that we can be. Then throw in, negative news and world stress and climate change and all the rest of it. When you have all of these stressors one on top of the other, and you have it day in and day out without any respite or any relief, that can then, for some people, trip them over into presenting with mental health, with mental health symptoms. And, often people say to me, like, well, how do you, like, why do some people get mental health symptoms and then some people don't, when they may have both gone through the same stressor? And again, I think it just comes down to the amount of insults that individual has had on their system, like the amount of stressors, and then how those stressors damage the metabolism, and then how the metabolism shows this as a characteristic or as a symptom. It may come out as for some people, you kind of alluded to it, if somebody had, say, if there was a natural disaster, okay, and you had this chronic stress for a year after this natural disaster, some people, perhaps they develop skin rashes, or perhaps they lose a lot of weight, okay, from this stress, or perhaps they, what else could be? Perhaps they develop some sort of stutter, something like this. So they have these kind of like physical responses to this traumatic event, whereas other people may develop panic attacks, they may develop very high anxiety levels, they may develop agoraphobia, claustrophobia, and so on. So I don't think we fully know or can say how each individual is going to respond, whether it be in physical symptoms or mental health symptoms. Like how are they going to show up after this event? But when we go back to thinking about this kind of chronic inflammation and chronic stress over time, it's playing on the neuroinflammation. If you're highly stressed and you're inflamed, you're also likely going to have worsening of insulin resistance. Your mitochondria are going to become unhappy. They're going to be unhealthy and broken. Your oxidative stress, you're going to have more oxidative stress there because of your environment and surroundings. So all of those kind of shared mechanistic pathways that we talked about earlier, they all worsen, right? And they all kind of come together cumulatively and push that individual to then express as a characteristic, of psychosis or of anxiety, depression, something like that. In terms of the exact whether it be psychosis or whether it be anxiety or whether it be, mania or hypomania, I don't think we fully know which of those will be expressed by an individual based on their level of stress. Perhaps we do. I don't. I don't know if that research is there. I don't think we fully know. But I do know that, when you bring all of those shared mechanistic pathways together and you have things like chronic inflammation over a long period of time, if that's not sorted out, if you don't bring that down, if you don't fix that, you don't fix the body and the metabolism, you are more likely to end up with high anxiety, with high depression, and with increased risks of psychosis and so on. So you got to look at it as these stressors and environmental assaults just compounding on the body, and you not having, unless you're dealing with it, you are not giving your body a chance to step into this kind of healing mode or timeout mode where your mitochondria can heal and they can fix. So if you're not doing that, you're just building up and then more likely to end up with a diagnosis. Does that make sense?
Yeah, I think we can simply learn from the wisdom of car engines.
Yeah.
If you run a car on a very, very fast speeds for very long times, of course it will something will go away
Yeah.
in it. So it's the same thing.
Mhm.
Uh, our time is, I think we're running out of time here, but we need all, of course, we need to make another episode. But to respect your time, let's do some final questions here.
Sure.
Um, in the Middle East, we face unique cultural challenges like high carbohydrate traditional diets, something like Ramadan fasting, which we are in right now, at the way that people eat in Ramadan, um, limited and limited training in metabolic psychiatry. What advice would you give to people here trying to responsibly implement ketogenic therapy in our region?
Yeah. Love this question because I love what you're doing, being able to take this information and share it with, with the Arab speaking world. So the first thing I would do is see very practically if Dr. Georgia Eve's book is in Arabic, because I think it might be. And if it isn't, then you need to get speaking with her and see if it can be translated. So her book is Change Your Diet, Change Your Mind. And for anybody that's listening, just wanting to know more, learn more, or even just get some very basic tips on how to get started, that's a great resource. Because it kind of takes you through different stages, how to do it very, very slowly and safely. But you raise a good point. There are lots of cultural differences, okay, and this is something that I work with my clients, because there's no one size fits all here. This is not a cookie cutter approach. You can't just give a ketogenic meal plan to somebody with specific foods on it and expect them to eat that for the rest of their life if that's not their culture. And so often people get stuck there. They say, oh, I can't do that because I don't like those foods, or it's requiring me to eat at these specific times and I can't do that. Instead, what you have to do, and this is how I help people, is find meals that you eat regularly, and then we turn them into ketogenic meals. Right. So the flavors of your country or the flavors of your culture, they don't need to disappear. We do some swaps. We make sure that the meal is more ketogenic. Okay, we're going to take out certain carbohydrates and replace them with something else. But the meal is still there. You still sit down with your family, you still sit down with your friends and enjoy it, because that's what life is all about. And then the same when it comes to the timing. So I've worked with many people who observe Ramadan, and actually they do pretty well with Ramadan, because you are used to fasting right through the day, even without liquids, which is which is really tough, right? So you're used to fasting. It means that the ketones shoot up, which is brilliant. That's what we're looking for. And then what you need to be doing is being very strategic about what you eat and when you eat once iftar comes along. And, depending on where you are in the world, of course, what time you can eat until and what time you need to stop. And so I'll work with people so that, okay, you might need to break with something sweet, but oftentimes people say, oh, well, actually, I can I can do my iftar with something that is not as high carb, and that's fine. And then I'll eat a ketogenic meal. And then, at least in the UK, then people will have a nap or they'll go to sleep for a bit and then they'll wake up at kind of like 2:30 a.m. because they'll need something else to eat and drink before going to sleep again and then getting up for the day. And so when they wake up and they're eating again at like 2:30, often people will be eating a huge meal. And I work with people so that that meal is not really big. We focus a lot on hydration, which is really important. Okay. And then having something that is not so big that you can't then fall asleep again, but still something where you can sit with your family, you can have something, it's ketogenic, and you feel good. And so actually, there are ways to be able to observe Ramadan and to get through Christmas and do all of these things, even while staying in ketosis and observing the nutrition plan that makes you feel good. So, I would encourage your listeners to not shy away from some of the instructions and things they may read that are perhaps more suited to, me being over here in the UK, right? And learn from it and adjust and adapt based on your culture, where you are in the world, and what works for you. Because every single meal that we eat on this planet has fat, protein, and carbs, right? We all know what they are. They just look different in different countries. And all we need to do is learn how to manipulate those in order to create the meals that we need to help us get into ketosis. And we can do that wherever we are in the world. There's definitely a way. So that's what I would encourage your listeners to do, right? Not get scared of the information and just find a way to fit it into their lifestyle. Don't change their lifestyle to fit it, because that will never work. You won't be able to do it long term. It's got to fit into your lifestyle, into how you eat, the timing that you eat, and what you eat, with some small swaps. That's what I would suggest anyway.
Yeah, and I believe when this work in our area gets more popular in the next years, there will be support communities, large communities support people who are trying to do this. Families would powerfully support the individuals that are trying to do that. So I believe it will be much easier for them to apply it even for lifetime, and I hope that this will happen and become mainstream soon. So one final question here. What message you would like to leave to mental health practitioners in our Arabic region about this new ketogenic service?
Yes. I would say to stay curious and open-minded, okay? Because our main goal as doctors, psychologists, nurses, dentists, our main goal is to help people to feel good and to live a long, happy, healthy life. Okay? That is our goal. First, do no harm and help people to feel good. Now, we have been taught so many things as to how to run our profession. Okay, we know how to do our job, but there's always new research coming. And we must remain curious and open-minded enough to understand that there may be other therapies that can also help. It doesn't have to be my way or your way or his way or her way. Okay, it can be all of these things together. So if you're a practitioner and you help people medically or psychologically, or you're a gym instructor, whatever you are, if you help people to feel better, you have to be open-minded and curious about how ketogenic therapy can improve your patient or your client's mental health. It's not going away. Okay, this research is coming out thick and fast. And if you want to help your patients or you want to help your clients, you need to understand how this works, why this works, and how to support your clients and patients so that they can feel better. So being open-minded and curious is really, really important, because we're coming to Egypt, you know, and we're coming to lots of different places across the world with these therapies. So you want to be a practitioner that is open to finding as many different ways as possible that your clients and patients can feel better. And this is going to be one of those.
Great. Thank you very, very much for this rich conversation and your precious time that you gave us today. Finally, where can people find more about you?
Yeah, well, thank you so much for having me. I really appreciate it, and I just hope that all of your listeners were able to take something from the science and from the research and from what I've shared. So yes, you can find me by putting my name into Google and I'll pop up. You can also find me by going to my practice website, which is www.ikrt.org. You can email me there. I'll be able to get back to you if you're looking for support or a community, or if you've got a loved one who needs some support, please get in touch, and I'll see how I can help. And if I can't help, you know, I'll refer you on to somebody else who I think might be able to help you. But yeah, so pop my name into Google or come to my website and get in touch. And it would be lovely to hear from all of you.
Thank you very much, and I hope to do more episodes soon with you.
Yeah, thank you so much. It's been an honor.